Foreign accent syndrome, FAS, is a rare neurological condition where a person's speech takes on an accent perceived as foreign, despite not having learned it. This is typically caused by damage to the brain areas responsible for speech rhythm, melody, and articulation. The causes of FAS is often linked to brain damage from conditions like strokes, head injuries, or tumours, and can also occur in disorders like multiple sclerosis. In some cases, it may be functional, arising without clear structural causes, possibly related to stress. The person's speech retains the same language, but is altered in intonation, rhythm, and articulation, making it sound like a foreign accent. To get a diagnosis would involve speech pattern analysis and neurological imaging. Treatment focuses on addressing the underlying cause and speech therapy to manage the changes. Recovery varies. Some may return to their original accent over time, while others may continue speaking with the new one. Fregoli delusion is a rare and unusual psychological condition in which a person believes that different people around them are, in fact, a single individual in disguise. Despite changes in appearance, clothing, or even gender, the person experiencing the delusion is convinced that this one familiar figure is constantly altering their identity to follow, harm, or manipulate them. It's a fixed, paranoid belief that can be deeply distressing and disruptive to everyday life. This disorder is often linked to schizophrenia, brain injury, or other neurological conditions affecting perception and recognition. A person with Fregoli delusion may interpret unrelated encounters, like a stranger in a shop or a passerby on the street, as the same person they fear or mistrust, simply wearing a different face. Treatment typically involves antipsychotic medication and psychotherapy to help manage symptoms and address the underlying cause. Factitious disorder, previously known as Munchausen syndrome, is a psychiatric condition in which individuals deliberately fabricate or induce physical or psychological symptoms to appear ill or injured. The primary motivation is to gain attention and sympathy, rather than any external reward like money or avoiding responsibilities. A severe variant, known as Munchausen syndrome by proxy, now called factitious disorder imposed on another, involves a caregiver, often a parent, intentionally causing or faking illness in another person, typically a child. This form is considered a serious type of abuse. Key signs include intentional deception, a lack of obvious external gain, and a wide range of feigned symptoms or manipulated medical tests. Diagnosis is difficult, as affected individuals are often highly convincing and may have complex medical histories. Treatment focuses on addressing underlying psychological issues and managing harmful behaviors, but outcomes are often limited. Thanks for watching. Please support, like, and subscribe.